Hi, this is Dr. Jonathan Fong again with the Venice Ocala Heart Institute. We're happy to share with you today something that comes up not unexpectedly and not rarely. That is that we deal with both heart disease issues as well as vascular disease issues. And in this today's segment, I wanted to talk to you a little bit about the presence of vascular disease both in the heart arteries as well as in the arteries supplying your brain, called the carotid arteries. There are, on occasion, times when we find disease in both of those areas, and the issue arises of which one should you treat first. Typically, we will treat whichever one is symptomatic first. If, in fact, they are both asymptomatic, we will treat the one that presents the most risk to the patient. In general, that tends to be the arteries going to the brain, the carotid artery, especially if it involves the side that controls your dominant side, the side that you write with. For most people who are right-handed, that ends up being their left side. The benefits of having a cardiovascular surgeon who does both heart surgery as well as vascular surgery dealing with this issue is the fact that we can decide based upon the entire picture of the patient which one we should do first. Secondarily, at the Venice Ocala Heart Institute, we have a dedicated team of both surgeons as well as anesthesiologists who only do cardiovascular procedures. The benefit of that is that you don't have to worry about whether the anesthesiologist is capable of handling a very sick heart in the event that the carotid surgery needs to be done first. In contradistinction, you don't have to worry about whether the carotid arteries are going to be taken care of well if the heart has to be operated on first. So we have both of the options available to us. In other places, you might find yourself being treated by just a heart surgeon who does not do carotid surgery, or a vascular surgeon who does not do heart surgery. And it takes a great deal of coordination on that in those situations to come to the same underlying solution, period. In our case, an example of a case that we did recently was a gentleman who had both of those disease processes in place, and the vascular surgeon asked the cardiac surgeon to do his portion first, and the cardiac surgeon wanted the vascular surgeon to do his part first. Ultimately, the patient came to our attention because neither party wanted to deal with the situation. After evaluating his situation, we were able to come to a reasonable solution, and in a staged-wise fashion, we were able to treat first his carotid artery and then come back and do his heart surgery. And I'm happy to say that he did quite well. So if you happen to have this problem, we'd be more than happy to have you get in touch with us. If you have any further questions about that, you can always reach us at the Venice Ocala Heart Institute.com that has our contact information.